G'day, if you are dealing with any disc injury, L4, L5, any impingement, slipped discs, a niggle or even sciatica, you aren't alone. I'm Steph and I'm a clinical Pilates instructor. I hold a diploma in injury prevention as well as rehab for your movement. In this playlist, you will find everything from the mat to the barrel and also on the reformer and other clinical apparatuses. You will find exercises safe for slipped discs, L4, L5 especially, any back niggles as well as tension release. We are at home, so you might see Rufus the golden retriever floating around in some spot. Although everything in the following session is evidence informed, it was recorded with a real situation, a real body. Let's respect the process. If you are working through an injury, pain management, or broaden your mobility and wanting to move through with more intelligence, you might have found this video at exactly the right moment. If it helps, please pass this on to someone else who may need it or has been talking about the same kind of niggle or the back pain that you've been talking about. I hope you find what your body needs here, not only in this playlist, but throughout the whole channel to keep showing up in your day-to-day. Let's get into a little bit of an assessment and then movement that's really going to nourish this L4, L5 disc impingement. If you don't have a barrel at home or a foam apparatus, you can either use a cushion or a block. You can also find Mermaid, Merman on the ground, the floor. We don't necessarily need to be lifted. What it does help is just the hips are aligned. No kind of lifting of the hips. Right leg in front. If you don't have a block, you can also use a book, but sometimes I like to prop up that left glute. It might be comfier with a pillow. If you've got a pillow, if you've got a block, you can use either. We're gonna reach those arms up to the sky. Beautiful, try and relax through the shoulders. There we go, nice. Reaching right arm down to the floor, left arm stays up to the sky. You can look at it, beautiful, reaching all the way over. Nice, and you might be feeling this more in the left hip here. Good. And then we're gonna reach that left arm to the floor, right arm to the sky, and that's where that hip will start to say good day.
That's where the relief comes, actually.
Yeah. And that's the thing with a disc injury, we wanna have mobility, strength, but also relief, stretch, and release. So there is a really fine balance when we are working with the spine. Good, couple more each way, just seeing how much we can reach that left arm over, beautiful. And then on that next reach up with that right hand, we're gonna try and find left ankle, left knee and find that twist towards the reformer. Beautiful, yeah, you got it. Nice, you can take this as deep as you'd like, never forcing any twists because we're starting to now work with the core, that powerhouse. So we feel even, right arm reaches up, left arm reaches down. We're gonna walk all the way down to this bolster and just, yeah, relax out of that. Might be quite intense for that left hip. Can you reach your hands all the way to the bolster? You can tell me no. Good, I'm gonna remove that block and just find a bit of hands-on assist here. This just deepens the lateral flexion while the pelvis stays grounded. Breathing into the body for 5, 4, 3, 2, and 1. Good. Then we're going to come all the way up, laying onto the back or pillow like we did on the barrel. So nice and slowly. Good. Well done. We're going to start to open up that hip a little more. So left over right, figure 4. Couple of things here, we've got a bolster under Tanya, so it just replicates and ensures the spine is not reversing in that C shape. So that slouch, lean over often causes the disc to push out. So what we're starting to do now is open up that left glute a little bit, left hip. How's that feeling?
Good. Awesome. Figure 4 has been with me for years.
Yeah. And it's an important one because our glutes and our hip all attach into our lower spine, our lower back. You're going to get some really beautiful release. But the trick is to not do it too much because then we're opening it up While it relieves posterior pressure and reduces muscle tension, it's also important to build strength in the posterior chain, especially the glutes. And
What's
build
safe?
both.
Yeah.
Good. Grab onto this behind the knee, this leg behind the knee, if that feels okay. You're probably balancing on a bit of a beam there. Nice. Good stuff. And if someone didn't have that type of mobility to reach their knee, I would simply come up and give a bit of hands-on assist with my leg and just push into that.
That's a lot easier.
You can also push into your left knee. And then you can kind of shake your legs left, right, and just see how your back is feeling. You're more than welcome to do this flat on a mat or the floor as well. I've just propped Tanya up on a bolster today because it's just nicer to feel elevated.
And my back hates laying flat on a floor.
Yeah. It's so bizarre because like that, you'd think that spinal alignment is laying flat on the floor, but it's not.
It's not. Yeah, I'm always in pain when I'm laying flat.
Yeah, it puts pressure on it. So let's give those legs a bit of a squeeze. Yeah. So we'll go right over left. So I can already see in your body that this is already looser.
Yeah.
Yeah.
It's a lot easier.
Just a disclaimer here, this stretch needs to be done carefully because it will release the piriformis muscle. Lift this leg up to the sky, have a little balance, bit of core here as well. Nice, I'm just going to press into this leg.
Yeah, you're testing my balance.
Yeah. Well, we are on something that's like vertically lifted off the floor. You can use a pillow, it doesn't have to be a yoga bolster. If you don't have an instructor with you or I'm not there with you, you can also place your leg up on a wall. It can be really super supportive and offer a lot of feedback for this stretch. And then in our next videos, we're going to start to build a bit of a strength regime. You can head to the posterior chain or the joint health to both build strength through injury. Feel free to shake those legs left, right, and give them a bit of a hug. Awesome. So once the body's kind of opened up and stretched out, it's safe to then start to build our practice in a little bit more rehab strength-based options. Nice. And reaching for those toes in a lengthened position. Let me just see that. Feel okay?
Yes.
Nice.
After stretching, if I do this at home, it spasms
Hinges.
straight away.
So if I place a block underneath those feet and you try and reach for that block, does that increase the intensity?
Yeah, it does.
Yeah. Good. Slowly start to come up neutral spine, and you can just have a nice little 90-90 out of that. Just left, right, just getting into those hips. So we're going to do a variation on the mat now. I've got a bolster. You can use a rolled up towel. You can use a hotel room pillow or your own pillow at home. So you can basically do this if you're traveling, if you're at home, whatever floats your practice. We're going to slowly start to draw the hip bones here, legs behind us, hands out in front. This cobra, this flexion is super important that you honor your body, lay all the way down flat first. And just notice how that's feeling, quite neutral. Because we are elevated through a prop, you might be already feeling a little bit of a release through the lumbar spine area. And the more weight you push in your elbows, the more you're going to feel that length. I'm just going to come in with a bit of hands-on assist, just pulling through the legs a little bit. Feel okay? Yeah. Nice. And then we're going to slowly start to draw the spine up to the sky. When I say spine, I mean head. You know what I mean? And then just relaxing through the shoulders. Beautiful. And Tanya's going to just flow up and down through this cobra according to how it feels in her body. And she's using those elbows to bend and then extend to find flexion. Good. And then extension through the spine. Beautiful. So I really love to pair this with a bit of breath, so it's starting to become that therapeutic finish to a wonderful session. If this ever gets too intense, feel free to just stay on the elbows on the mat and breathe into your lower back. Good. And just as many reps as you like here, just until we're getting at least between 30 to 60 seconds of work. or of movement. If you are a little bit more in depth of your practice, in depth in your clinical sessions, 60 to 90. Time over tension can be an advancement. So even if you start the first time doing it for 15 seconds and then maybe for 30 and then for 45, that's an incremental increase in movement, in progress, in capacity, in overload. So yeah, honor each session as your body starts to really improve and take it as an improvement in your clinical practice. Nice. Beautiful. Good. And with propping the belly up, we are just moving the floor a little bit further away so it's less jarring for that lower back. It would be safe to do without it. It's just more chance of, impingement, which we're obviously avoiding.
More supported.
Yes. Great way to say it. Thank you. It is more supported with a bolster or a towel or a pillow. Next time you push up to an up stretch, we are going to undergo a shoulder stretch. So start to drop one shoulder towards the floor. Inhale, press the floor away. Exhale, other shoulder. Really slow it down if you are quite tight and sore and tender in this area, but it's a nice one to inhale. Exhale, drop the shoulder. Inhale, exhale, drop the shoulder, and just stretch out the top of the delt there. Beautiful. For 3, each side. Nice work. 2. And 1. Good. Push through the hands, come up to the knees. We're going to find our way through tabletop. And we're just going to find an arch of the back, tuck the chin, happy cat, angry cat. Try not to flex too much, even if it's just the concave of the spine. So nice. And we just want to counter pose for that flexion. So yeah, it might feel a little bit intense there. How does it feel? If this session helped you or added to your already capable recovery regime, save it. Come back to it. And if you don't come back to this video, I will not take it personally, because I'll sleep well knowing that this clinical movement helps you recover and will always allow you to tune into your body when you need it. That means I've done my job. That's what this is all about, making clinical Pilates accessible to you from your own home. Rehab isn't just a one and done session. It's showing up again and again until your body creates that awareness and those mind to muscle connections that can change everything, even the way we're feeling. That's the whole idea. If you know someone who's going through a similar journey, a slip disc, a post-surgical recovery, or even just a pain point that they keep talking about, please pass this on. Life does throw us left and right sometimes, and these sessions are here for them too. If this is the content you want to keep seeing, or if you're moving through something specific, drop it in the comments. Subscribe or head to the online community where live sessions and clinical advice can become unique to your circumstances. I'm Steph Kenny, a dedicated clinical Pilates instructor, here to help you keep showing up in your body and in your day-to-day. Much love, and I'll see you in the next one.